Very good evening, friends. Today we are celebrating Safe Motherhood Day. Safe motherhood starts long before your pregnancy. It begins with planning and a healthy lifestyle. If you plan a pregnancy, then there is time to detect any complication, to prevent complications, and if you do have, to manage a complication in time. It was in 1987 that UN declared this Safe Motherhood Day. The initiative was started because they felt that every woman should have a pregnancy that was monitored, that was a good experience, that was safe, and that gave rise to a mother who was safe and a very healthy infant. So this is a right. Safe motherhood, that you have a safe pregnancy, safe delivery, a safe infant, is a basic human right. Now, this Safe Motherhood Day has been declared by the United Nations, the American Association of the Fertility Specialists. But in India, 11th of April was the birth date of Mrs. Gandhi, who was the wife of Mahatma Gandhi, and this was declared by the government as Safe Motherhood Day from 2003. Now, what do I mean? What are all the parts of this Safe Motherhood Day? Now, as far as this Safe Motherhood Day, what was the need? The aim when they started it was to reduce maternal mortality. Unfortunately, more than 10% of maternal deaths are from India. In spite of everything that we are doing, we are still not able to eradicate these things completely. Our mortality rates have fallen down with following many of these initiatives, but still we have a long way to go. So, what are the aims, or what is this year's theme? Now, this year's theme is stay safe, stay at home in Corona. You want to protect the mother and the infant to be safe from the coronavirus. But in the broader perspective, what do you mean? What are all the pillars, or what forms this safe motherhood care? First of all is family planning. Now, why would you say family planning? It is important to not only say family planning, but we are offering a basket of choices. One size does not fit all. Whether it is a oral contraceptive, a condom, a rhythm method, whether it is an IUCD, whether it is vaginal sponges, everyone has a need. People want a choice, and it is much better to discuss with your doctor about these contraceptive choices. Many people feel that if they get pregnant, so what? We will get a termination done. Unfortunately, I don't want a pregnancy is not one of the reasons for terminating a pregnancy as yet. Also, it is not a method of contraception. It does have its own downside as far as the health of the woman is concerned. So, a strong family planning program is definitely going to help you in deciding and choosing the appropriate time for you to have a pregnancy. Now, the second thing is the antenatal care. Now, as far as the antenatal care, things have changed now. We will register in the 7th month. The dictum has become, as soon as you know you are pregnant, go and visit a doctor. This is called the inverted pyramid. Rather than no visits being there till the 5th and 7th month, the first 3 months are the most important. Not only do we make sure that you have a baby which is growing properly, but also if you are likely to have any problems in the baby, like a chromosomal problem, or you are going to be having some preeclampsia or other problems of pregnancy, we can predict it. We can help predict it. We can help you decide how to manage, or to treat so that there is not much of a problem in the future. So antenatal care is there when you start going to the doctor early enough, before even you have just missed a period. At that time you go, and the doctor will give you a schedule according to all your risks, according to what you need, but certain standard things are needed by everybody. It is also in the antenatal care that you will have a plan of delivery which will be formed. So what is the third pillar? The third pillar is the delivery, the natal and the neonatal care. So as far as the delivery care, it is the hope and the vision of our government that all deliveries are, well, we would like them to be institutional, but if it is not possible, at least they should be monitored. They should be monitored, guided by some competent person, preferably a doctor or an obstetrician as they are said. But even if that is not there, we would like it to be monitored by a skilled midwife, an A&M, or a DAI as they are called. Somebody who can understand that this is not normal when there is a problem and can refer them to a center which is a higher center in time. Next, the baby is born. Now we would like that there is a neonatologist or a pediatrician present who will make certain that the baby born is healthy and doesn't require any further monitoring. The next pillar is, of course, your postpartum period. Now in the postpartum period, you will say, what is there? There are several things. You have just delivered, your body has gone through a lot of stress. So postpartum is not just about coming after 7 days to see whether your episiotomy has healed or whether your cesarean wound is fine. No. Besides looking at your bleeding, you are going to need help and advice as far as lactation is concerned, management of episiotomy, complications of an episiotomy, about your diet, about how to start exercise, when to start exercise, and believe it or not, mental health. The time after delivery can be really turbulent, especially in today's nuclear families where nobody is there to help and guide you about things which were never a problem when there were large joint families and mothers rarely had to bother about the child. So lack of sleep, frustration, no milk was not a problem. So you need somebody to handhold you. You may undergo something like a incontinence, urinary incontinence, stool incontinence, leaky breast. So all this needs help. So this is your postpartum component. The next is post-abortion care. There are times when somebody may have a miscarriage. You don't want a miscarriage, but there are problems that can occur after a miscarriage. Or you may have undergone a medical termination of pregnancy for whatever reason. Now in both these scenarios, if at some point of time you find that there is any complication, whether you're bleeding, whether you're having fever, foul discharge, or any other issue, you definitely need to know where to go to get advice to manage all these complications. You just may need to go and show somebody. You may need antibiotics, you may need admission, and you may need further management. But it is so important to have a proper post-abortal care to prevent complications in the future like blocked tubes and even more severe complications. Now one more thing which is a right is your reproductive health right, and that involves management and care of sexually transmitted infections, the reproductive tract infections, HIV, all this, the treatment, management and care. Yes, you should be able to manage to get advice, treatment for all these conditions. It should be done with dignity and in total anonymity, respecting your privacy. So now we have said this is what the pillars are. Now, how do you ensure that this is going to be there? Now, as I have already mentioned to you, this begins lots before your delivery. So many factors go into seeing that you have a safe and a wonderful experience during your delivery and your pregnancy. First of all, it is the age of marriage. If your age of marriage and first child is not a very early pregnancy, you are more likely to have a normal pregnancy without complications, better experience, not only problems to you but also to the baby. The second thing is, as I've already told you, you need to see that you go to the antenatal early. How early do you go will also ensure that. It is not just that you are looking at the pregnancy when you go for the antenatal, but over here you are looking at everything else. Your diet, your nutrition, your weight management, plus you need to see about your immunization, your problems, any symptoms that you have, plus the plan of delivery, the place of delivery, as well as who is going to deliver you. This will all depend on a lot of factors. So, if we need to do all this, what is supposed to be done? First of all, we need to educate women. We need to educate women about safe motherhood, that this is there, it is for them, that it exists, and all they need to do is go to their nearest healthcare center, whether it is a primary healthcare center, whether it is an institution which is a government institution, a semi-private, a private institute. Be sure that you go to some place which is near your place. You will have to go many times. So don't choose a place which is so far away that going there only puts you off. So go to and seek antenatal care. So after giving you good advice about education about safe motherhood, the second pillar is antenatal. Now I've already told you that you should go early. It helps in detecting all these things. It will help you in diet. It will help you in all this. But what I have not mentioned till now is the two most important things. It is looking for and helping you and advising you about complications. What are we worried about? What are we looking for in the antenatal period which causes a lot of problems to the mothers? First of all, hypertension. If you have essential hypertension or hypertension which develops in pregnancy, which is called preeclampsia. The second thing is diabetes. Having diabetes developing in pregnancy can cause havoc not only with you, but it can also cause massive problems to the baby. So this was the second thing. The third thing that we worry about is preterm labor. So besides preeclampsia, we have infections. Infections in pregnancy also can be a big problem. So all these things are some things. Preterm labor is also something that we worry about. So these are the four major problems that worry about, of course, besides anemia, which is so prevalent. Now, this is as far as looking for problems. But the counseling that you give a woman as soon as she is pregnant, that is also very important. Besides telling her what she should eat, she's not supposed to eat for two. Her nutrition should be such that she gets all the proper amount of food depending on her pre-pregnancy weight, her pre-pregnancy state. If she is underweight, she needs to eat healthy to have an appropriate weight. Whereas if she is obese, she cannot afford to put on 2-3 kgs every month. So see the BMI when you come. Accordingly, you will receive diet advice. If you want, it's always a good advice to see a nutritionist. You will get proper advice on your protein requirement, the caloric requirement, also the trace elements, the minerals and everything. Having said that, everybody does not need supplements. If you're eating healthy, you're young, you're normal, well, you may require a little bit of an iron and calcium. But don't stress if everybody is not taking fancy proteins and many other supplements. Your daily diet is quite good enough for you. So this is what will be in the antenatal as well as in the diet that we need to see that you do. And lastly, that I have already mentioned about the delivery, the planning of the delivery. Because you see, if you are at a high risk during the antenatal period, we expect that they will refer you to a center where you can be managed no matter what complication. Every center, today the aim is the primary health center should be able to have emergency obstetric care. People are trained in that, people are being trained in that, so that at least the first level treatment you will get wherever you go before you are transferred to a higher center. Plus the delivery plan, whether you will want anesthesia, what is going to happen, who is going to be your birthing companion, all that will also be discussed. Now, having said that, you will, it is not just that you will. The government has done something very active and concrete about it. Initially, there was a program which was called the JSY, or the Janani Suraksha Yojana, which looked after all the expenses of the antenatal mothers, the laboring mother, and the baby newborn. That was then extended to JSSY, that is the Janani Shishu Suraksha Yojana also. So where the infant also was looked after, is being looked after. So there is no reason for anybody to say they cannot afford. All your drugs, most of the things that are covered are already covered in it. And by and large, the complications don't occur in deliveries which are high risk only. Sometimes it is the low risk patients who have problems. So if you have gone to an antenatal care, if you are looked after, the chances of you having a major complication doesn't arise. You are optimized for labor, and so even if there is some problem, you are able to face it much better than somebody who has never been. Now, what are the obstacles in our country? Why are so many women still dying? Why people don't come? One of the major reasons is poverty still. People don't want to travel anywhere. They think that it's fine. Their relatives delivered at home, so why can they not deliver? Illiteracy is another problem. So many times you don't know. Lack of awareness. Then there are so many social taboos about not having this, not having that. As I just told you, till today the belief is, how can we write a name? She's only 3 months. How can we register so fast? We will register after the 7th month. I mean, why would you register, or why would you go after the 7th month when going early will help you? There is also the problem of inaccessibility. There are many areas where all is not freely available. It is not as though this is, yes, we are trying, and I'm sure that most places have it. But in many tribal places and smaller places, they do not have the facility nearby, which makes it difficult for women to go. And lastly, I think there are many taboos which are practiced in most communities, which are harmful. So I think it is time that we understood that safe motherhood is for everybody. The safe motherhood is not only having a baby, but it is being healthy. It is having reproductive health. It is being healthy before your pregnancy. It is choosing your pregnancy time. It is being looked after by somebody during the pregnancy, monitored in labor. Sorry. Having a safe delivery and a safe baby. Thank you.